most people are treating symptoms because they want repeat business. A lot of people are treating, different types of things. They're treating the symptoms, not what I love about this conference that we're at and everything where we are with everybody. We're treating root cause. I love that I've been trained and brought up to treat a root cause or a functional problem or the problem that is the issue so that they don't need to get continued therapy.
Behind the practice.
Welcome back to Behind the Practice. I'm Katie Brinkley, and today we are so fortunate to sit down with Estelle Farrell. Estelle, thank you so much for joining me on Behind the Practice today.
Thank you. Thank you for having me.
Well, I've been looking forward to this conversation because chronic pain is one of the most common reasons people enter the healthcare system. And so many patients feel stuck in the cycle of temporary fixes. And I think that what you're doing is helping people change that mind shift on what we're getting wrong in pain care.
It's true. I mean, most people are treating symptoms because they want repeat business. A lot of people are treating, different types of things. They're treating the symptoms, not what I love about this conference that we're at and everything where we are with everybody. We're treating root cause. I love that I've been trained and brought up to treat a root cause or a functional problem or the problem that is the issue so that they don't need to get continued therapy or continued treatments. And some people do have different diseases that require continued treatment. And that's not to say symptoms should not be treated, but
it's fine.
What I view people to be as least more functional, what they can do for themselves and to give them the tools that they can do those things.
What led you to focus specifically on chronic pain and scar-related pain?
Honestly, I've been exposed to so many people that have had different scars that were disfiguring and painful. I even had a knee surgery. I had a C-section, and I just was not happy with those scars. And when I started taking the courses, I realized, oh my gosh, this is like amazing. Those scars look so beautiful now after we treated them. And when I started treating patients with them, they realized, well, I don't have that anxiety associated with that scar. I don't have that pain associated with the scar. I can move more freely. And, it doesn't bother me anymore. A lot of times I used to be very self-conscious of my scars, and patients are self-conscious of the scars they have from different surgeries, whether it's a neck surgery, a breast surgery, or a spine surgery. And once that scar is treated, they're not so self-conscious anymore. Yeah. And they feel more free to be themselves and move and do different things that they wouldn't do before. They're not trying to cover it up. Yeah. And they can actually go out and enjoy themselves.
Well, the scar, it's amazing how it can be tied to the mindset.
Yes.
So let's talk a little bit about pain management, and because that's where traditionally, like you said, we just are fixing a symptom, or just not even fixing. We're just, giving a temporary fix.
Right.
So was there a moment in your career when you realized that traditional pain management it wasn't enough? It wasn't the answer?
Well, actually, I think I had very good teachers along the way. So I've been taught by a lot of good people that already knew much of the system was broken, and they had a lot of good tools for fixing the system. So when they brought in students like me, and we're going up, the ways of growing up and teaching people and patients, so it's, a lot of be one, do one, teach one. We learn a lot of skills that we can use to help our patients move forward and do better. Mm-hmm. And, so it wasn't just one epiphany or another. And a lot of the rotations and things you do when you're in training and the different teachers you can have a teacher that says, oh, that's something that doesn't make sense to me and I don't want to do. And then you have other teachers that are like, wow, I've never seen that before. That is a great view. That's a really good tool that I can use. And so that's part of why you have training.
Yeah.
And, you're never done training. There's so many good teachers out there in life that, you just keep going forward.
What do you think is one of the most common misconceptions people have about chronic pain?
The most common misconception most people have about chronic pain is that people are drug addicts, or that people are addicted to medication or addicted to something. And there's a difference between addiction and dependency. Yes, there are many patients that do have a level of pain that require controlled pain medications. And there's many things that are coming out now that you can do that don't require a lot of controlled medications. And that's not going to take away the fact that there are some people that do need some. And there's a lot of good little guidelines and a lot of good things out there to keep people on the right track. And we had a lot of hiccups in the 2000s, and that's, was a very difficult time for pain management to try and find its space. And there's a pendulum that does swing back and forward that kind of, we'll say when people need more medications and less medication. And
It's very
it's more of a political approach than it is a realistic approach. And so, it's really nice when we can actually have groups of people coming together and saying these are some real approaches to helping people.
Often I feel that it almost feels like the pain management is very formulated, very regulated. Where do you feel that pain medicine falls into that trap?
Pain medicine does fall into a trap of guidelines, especially for controlled medications, but, also more so for the different types of injections. We're limited by what insurance says they'll cover. We're limited by what the companies who produce the products say that they can do. And it's kind of like sometimes you have this really great ball of everything you can do, and the institutions also limit what you can do. Let's say legally you could do all of this, and it's appropriate and it makes sense. But the insurance only lets you do half of that. And because the insurance only lets you do about half of that, your institutions might let you do half of that or even less. Because the institutions have to protect themselves legally. The institutions have to protect themselves financially. And, there's not, and they also don't have people are trained in this other half of the information that's out there. So you're going to start seeing, a lot of people that are just focusing on this other half, but not all of this out here. So independent practitioners that can do the whole thing and teach others and do things become a bit of a lost animal, because we get pushed out by the institutions that buy practices that, or pushed out by the different companies that have their political agendas in different ways. And so it's really cool when we can see people coming together and be able to do the whole thing.
And Estelle, I feel that what you're talking about, it's so important because we're still dealing with a healthcare system that practices mostly in symptom suppression.
Correct.
As opposed to symptom remedies and getting people on the right track.
Well, I'm an osteopath, and we were trained initially on finding more of a root cause, more of an actual solution. We're trained in all the same things as an MD, and we have all the same residencies as an MD, but our philosophy is to look at a person as a whole person. So it's body, soul, mind, and physical. And, there's a whole interaction in those things. And just like we're talking about that whole person approach, we're talking about the whole ability of everything. So things come from the root up. So you have a root cause, you have different levels of where medicine works and where it doesn't work.
Yeah.
And, there's a lot of people out there. Just like I talked about this whole thing, you're going to have people, outliers way out there that they're like, this is weird, or this is really too weird. and it's honestly, if you don't have people doing some of the whole thing, you won't know what's too much this direction or the other direction.
Yeah.
You need to have more people that are actually doing real things.
What's one of the hardest truths that you've had to tell one of your new patients that comes to you with chronic pain?
I mean, the hardest truth is when I can say, I have a lot of education, I have a lot of ideas, I have a lot of things that I can do, but there's some things I just can't do. And some patients just may not be a proper fit. Some people may have to be on certain medications that, maybe they have already got a good team. Maybe, there's things that, should be done or not be done, or if their insurance or their lifestyle or their living situation may not allow them to get the treatment they need.
How do you prevent a relapse from happening once they've already seen their pain improve?
One of the ways of having relapses and dealing with those things is having a toolbox. What I like is for patients to say, okay, we've gotten you from point A to point B, and then you're going to have times where you go back and forth on them. And, you always want to stay more in the happier spot than in the non-happy spot. But there's going to be times where it kind of fluctuates. And there's going to be flares in life and different stressors and everything. So what you need to do is when you're feeling really good in this spot, know what your toolbox is for when something all of a sudden happens that pushes you this way.
Yeah.
So if you have a toolbox, then you are not going to be, going to the ER. You're not going to be going to all these different places. You're going to be saying, hey, you know what? I'm great right now. Then all of a sudden XYZ happens and I'm like, oh my God, I don't know what to do. Because when you're in a good spot, you already have your toolbox made. I can go to my list of my toolbox and say, oh, I've got this. I can do this. And then it kind of slowly brings you back to where you need to be.
I love that, because if you have the toolbox, there's always another tool in there that can
Exactly.
help you. Yeah.
So a lot of people, they specialize in something. Something's, if all your tool is a hammer, everything's a nail.
Yeah.
But it's good to have more than one tool in your toolbox. And it's lovely to have other people's impressions and ideas because, maybe I've got a screwdriver, a hammer, and, wrench. And I'm like, well, which one of these tools do I know? This other person over here say, oh, use your wrench.
Yeah.
Or, go use, something else that you got, maybe some finer tools.
If you could redesign pain management in America, what would that look like?
I think putting in the cooperation between the different levels of pain management and insurance companies and the government regulations. And, we see different snippets of times where it is actually moving right. But other times, there's times where it's problematic.
If someone's listening right now and they're saying, man, I've been dealing with pain for so long and I thought that this was my life, what would you say to them?
Then they need to change their lives.
Yeah.
It's, pain, it can be overwhelming. Pain can take over all of your thoughts and approaches and everything. And it's nice to have something that you can find out there that will take your mind directly off of it for just a moment. It doesn't have to be all the time. But when you have that moment of reprieve, you can actually take that time to figure out what your real needs are and what your real goals are.
So Estelle, this has been such a great conversation. If people want to learn more about you, they want to connect with you, they want to try a different way of addressing their pain, what's the best way for them to get in touch with you?
They can email us at info@az-pmr.com. Our office number is 480-955-1515. Our website address is www.az-pmr.com.
Amazing. Well, this has been such a great conversation. I really would love to dive into more about pain management with you again on another episode. This has been truly a great episode.
Thank you. Thanks for your time.
Behind the Practice is produced by Next Step Social and Podcasting and hosted by Katie Brinkley and Sean Quintero. A special thank you to our guests today. This episode was recorded live at the Boston BioLive Functional Longevity Summit. A special thank you to the team that helped make this podcast happen.